Today we are going to discuss hand. The ventral aspect of hand is called the palm and the dorsal aspect is called the dorsum of the hand. Here we can see the palm, the various structures that we see on the bare palm. This one is the thenar eminence. This is the hypothenar eminence. These are the creases on the hand and these are the 5 digits. This is thumb, this is the index finger, this is the middle finger, the ring finger and the little finger. We start from the lateral side. This is the first digit, the second digit, third digit, fourth digit and the fifth digit. And these are the palmar creases, the the wrist creases, the proximal wrist crease and the distal wrist crease. Now in this picture we can see the skeleton of the hand. The skeleton, this is the end of forearm with ulna and radius. And this one is, these are the carpal bones. The carpal bones are 8 in number and they are situated in 2 rows having 4 bones in each row. Talking about the proximal row has the lateral most bone as scaphoid. Then we have lunate, then triquetral and a small pisiform bone. And the distal row has, starting from the lateral side, trapezium, trapezoid, capitate and hamate. So these are the 8 bones of the wrist, also called the carpal bones. Now, these are the metacarpals, the 5 metacarpals. This is the first metacarpal, second metacarpal, third, fourth, and fifth metacarpal. The metacarpal has a base which is present proximally and the head of the metacarpal which is present distally. Now, talking about the digits, the bones of the digits are called phalanges. The thumb has 2 phalanges, the proximal phalanx and the distal phalanx, and the remaining 4 digits have 3 phalanges each. Each digit has a proximal phalanx, a middle phalanx, and a distal phalanx. Now, talking about the joints of the hand, we have the intercarpal joints or the midcarpal joints between the carpal bones. Then we have the wrist joint between the lower end of radius ulna and the 3 carpal bones. Then we have carpo-metacarpal joints between the carpal bones and the metacarpals. Then we have metacarpophalangeal joints. These are between the metacarpals and the phalanges, the proximal phalanx. And then we have interphalangeal joints that are between the various phalanges of the digits. Now coming to the cutaneous nerve supply of hand, palm basically. This is the palmar aspect and this is the dorsal aspect. On the palmar aspect, the medial 1.5 fingers are supplied of and the palm are supplied by ulnar nerve, and the lateral 3.5 fingers along with the palm are supplied by the median nerve, and a small part near the ball of base of the thumb is supplied by radial nerve. Now talking about the dorsum of the hand, the medial 1.5 that is just posterior to the medial 1.5 of the palmar surface, the dorsal surface of medial 1.5 is also supplied by the ulnar nerve. The lateral 3.5 is supplied by radial nerve, and the nail beds are supply of the lateral 3.5 fingers are also supplied by the median nerve. Now, what is palmar aponeurosis? Palmar aponeurosis is a thick sheath, aponeurotic sheath that is lying in the palm. It is an extension of the palmaris longus muscle, which is passing above the flexor retinaculum here, and it enters the palm. It is like a triangle with apex directed proximally as a continuation of the palmaris longus muscle, and the base is present at the level of metacarpophalangeal joints. Now, the palmar aponeurosis has 2 functions. Basically, it is attached firmly to the skin, so it helps in gripping of the hand. And secondly, it protects the underlying structures, which are the various vessels and nerves in the palm. So the palmar aponeurosis has a base that is directed towards the digits. At the level of the metacarpophalangeal joints, the palmar aponeurosis divides into 2 strata, a superficial strata and a deep one. The superficial attaches to the dermis of the palm, and the deep passes between the fingers and further subdivides into two slips each of these 4 digits, and they are attached to the sides of the phalanges. Um, so this is the palmar aponeurosis. Now in this picture we can see this is the palmaris longus muscle, which continues as palmar aponeurosis at the level of the palm. Dupuytren's contracture is a condition in which the ulnar side of the palmar aponeurosis gets inflamed and thickened. So what happens is that the fourth digit and the fifth digit, they cannot be extended properly and they are flexed like this. And this is a very painful condition. Now in the fingers we have fibrous flexor sheaths. The fibrous flexor sheaths basically enclose the long tendons, the flexor digitorum superficialis and the flexor digitorum profundus, which are extending till the phalanges. So the fibrous flexor sheaths, they are attached to the sides of the phalanges, and inside they are lined by the synovial digital sheaths. Now in this picture we can see this is the proximal phalanx. This is the tendon of the long flexor tendon, and these are surrounded by the fibrous digital sheaths. Now what is flexor retinaculum? Flexor retinaculum basically is a thickened structure that is attached to the in front of the wrist. It is attached laterally to the scaphoid and the trapezium bones of the wrist bones, and the medially it is attached to trapezium and the pisiform, sorry, triquetral and pisiform. So it is covering the anterior aspect of wrist. Now there are a few structures which are passing above the flexor retinaculum, and there are a few structures that are passing below the flexor retinaculum. In this cut section, we can clearly see the structures that are passing above and below the flexor retinaculum. So this green structure is the flexor retinaculum. The structures that are passing above are the palmaris longus tendon, the palmar cutaneous branch of median nerve, the palmar cutaneous branch of ulnar nerve, and the ulnar nerve and ulnar artery themselves. So these 5 structures are passing above the flexor retinaculum. Now the structures that are passing below the flexor retinaculum are the flexor carpi radialis, the flexor pollicis longus, the 4 tendons each of flexor digitorum superficialis and flexor digitorum profundus, and the most important one is the median nerve. If the median nerve is compressed in some disease of the flexor retinaculum, that is called the carpal tunnel syndrome. We can see various symptoms. In this picture again, we can see the 5 structures that I enumerated in the previous slide that are passing above the flexor retinaculum, and these are the structures that are passing below the flexor retinaculum. Once again, the main structure passing below the flexor retinaculum that gets compressed in carpal tunnel syndrome is called the median nerve. Now talking about the intrinsic muscles of palm, these are 20 in number, and they are arranged in various groups. One of the group is called the thenar eminence, having 3 muscles, and the other group is called the hypothenar eminence, that also has 3 muscles. In this picture we can see the thenar muscles. These are 3: the flexor pollicis brevis, abductor pollicis brevis, and the opponens pollicis. These are the muscles of thenar eminence. In this picture again, we can see the muscles of the thenar eminence, the abductor pollicis brevis, flexor pollicis brevis, and the opponens pollicis. Now the various attachments of these muscles are the opponens pollicis, abductor pollicis brevis, and the flexor pollicis brevis. These 3 are plus the adductor pollicis, which is also present on this side, on the lateral side of the palm. These have common attachment to the flexor retinaculum along with the tubercles of scaphoid and trapezium bones. And distally, the opponens pollicis is attached to the lateral side of first metacarpal, and the remaining 3 are attached to the lateral side of base of proximal phalanx of the thumb. The thenar muscles are supplied by the median nerve, and their action is according to their names. The opponens pollicis causes the opposition of thumb. Abductor pollicis causes abduction of thumb. Flexor pollicis causes flexion of thumb. And adductor pollicis causes adduction of thumb. The adductor pollicis has two heads. One is oblique head and one is transverse head. The oblique head is attached to the bases of second and third metacarpals, capitate and adjacent carpals, and the transverse head is attached to the anterior surface of shaft of third metacarpal. And commonly they are inserted into medial side of base of proximal phalanx of the thumb. And all these, the adductor pollicis muscle, though present on the lateral side of the palm, it is supplied by the deep branch of ulnar nerve, which basically ends in the supplying this muscle. And its action is the adduction of thumb. In this picture, we can see the two heads, the oblique and the transverse heads of the adductor pollicis. And this is a special muscle of the lateral side that is supplied by nerve of the medial side, which is called the ulnar nerve. In this picture again, we can see the muscles of thenar eminence and the muscles of hypothenar eminence, and this one is the flexor retinaculum. Now coming to the muscles of hypothenar eminence, these are also three in number. One is the abductor digiti minimi causing abduction of the little digit, the flexor digiti minimi brevis causing the flexion of the little finger, and the opponens digiti minimi causing opposition of the little finger. This picture repeats the same concept. Now coming to the attachments, the abductor digiti minimi is attached to pisiform, and it is inserted into the medial side or base of proximal phalanx of fifth digit. And the flexor digiti minimi plus opponens digiti minimi is attached to hook of hamate and the flexor retinaculum and inserted into the fifth metacarpal. Both these, all three are supplied by the ulnar nerve, and their action is according to their names. Now the other remaining short muscles are the four lumbricals, four dorsal interossei, and the four palmar interossei. Here, the fourth one is not mentioned because the first palmar interosseous muscle is sometimes rudimentary. Now the lumbricals, they are the first and second lumbrical have origin to the lateral two tendons of the flexor digitorum profundus, and the third and fourth lumbrical takes origin from the medial three tendons of flexor digitorum profundus, and they are commonly inserted into the second to the fifth digit, and they are supplied by median nerve. The action of lumbricals is that they cause flexion at the metacarpophalangeal joint and extension at the interphalangeal joints. Now the dorsal interossei and the palmar interossei both are supplied by deep branch of ulnar nerve. The dorsal interossei cause abduction of the digits and the palmar interossei cause adduction of the digits. These are the lumbricals. This is the first lumbrical, the second lumbrical, third lumbrical, and the fourth lumbrical. The first and second lumbricals are unipinnate, as you can see, and the third and fourth lumbricals are bipinnate. In this picture, we can see the lumbricals, the first, second, third, and fourth lumbrical, and in these two pictures, we can see the dorsal and palmar interossei. The dorsal interossei 4 in number, and they are causing the abduction. The middle finger is the axial line, and the movement is away from the midline is called the abduction. The movement of middle finger towards medial or lateral side both is called abduction. Now coming to the palmar interossei, these are 4 in number as I have told you. First one might be rudimentary. So one is attached here, second, third, and fourth, and their action is called is adduction. Middle finger is the axial line, and the movement of these digits towards the midline is called adduction. Here again we can see abduction by dorsal interossei. We can remember it by the mnemonic DAB and PAD. Dorsal interossei cause abduction, DAB, and the palmar interossei P cause adduction, PAD, PAD. So DAB and PAD. You can remember this with this mnemonic. So this is all about the palm of the hand. We'll discuss about the dorsum in another video. Thank you.